Did you know that 1 in 4 adults over 65 falls each year? And shockingly, medications are a leading cause of these dangerous falls. But it's not just older adults. Millions of people, regardless of age, experience dizziness, lightheadedness, or loss of coordination due to their prescriptions. From blood pressure pills to painkillers and antidepressants, certain medications can slow brain function, affect muscle control, or disrupt the inner ear, which is crucial for balance. In fact, studies show that up to 40% of fall-related hospitalizations are linked to medications that impair stability. In this video, we're exposing 10 common medications that can secretly make you lose your balance, and what you can do to stay steady on your feet. Some of these might be in your medicine cabinet right now. So stay with us until the end to learn how to protect yourself. 1. Sleep aids. Many people turn to sleep aids like Ambien, Lunesta, or over-the-counter options like diphenhydramine, found in Benadryl and some nighttime pain relievers. While they may help you fall asleep, they can also make you feel groggy, dizzy, and unsteady, even after you wake up. This is because many sleep medications slow brain activity, which affects coordination and balance. Some people report feeling like they're sleepwalking or experiencing a hangover effect the next morning. This can be dangerous, especially for older adults, as it increases the risk of falls and serious injuries. Even natural sleep aids like melatonin and valerian root can cause drowsiness in some people. If you notice balance issues, talk to your doctor about safer alternatives. Practicing good sleep hygiene, reducing screen time before bed, and maintaining a consistent sleep schedule can be just as effective, without the dangerous side effects. If you rely on sleep meds, be extra careful when getting up at night. A fall in the dark can be serious. 2. Blood pressure medications. High blood pressure is often called the silent killer, so it's no surprise that millions rely on medications like beta blockers, like metoprolol, diuretics, like hydrochlorothiazide, and ACE inhibitors, like lisinopril, to manage it. While these drugs can be life-saving, they also come with potential side effects, including dizziness, fatigue, and even an increased risk of falls. Here's why. Beta blockers slow your heart rate, which can make you feel lightheaded when standing up too quickly. Diuretics reduce excess fluid, which lowers blood pressure but can also lead to dehydration and electrolyte imbalances, making you feel weak. Some ACE inhibitors can cause sudden drops in blood pressure, especially when getting out of bed in the morning. Staying hydrated, standing up slowly, and monitoring your blood pressure regularly can help reduce these risks. Never stop taking your medication without medical guidance, but if dizziness becomes frequent, it might be time for a dosage change or alternative treatment. 3. Antidepressants. Antidepressants are essential for millions battling depression and anxiety, but some of these medications, especially SSRIs, like fluoxetine and sertraline, SNRIs, like venlafaxine, and tricyclic antidepressants, like amitriptyline, can increase the risk of heart problems. SSRIs and SNRIs affect serotonin levels, which can impact blood vessel function and, in some cases, lead to irregular heart rhythms, arrhythmias, or increased blood pressure. Meanwhile, tricyclic antidepressants can cause a dangerous drop in blood pressure when standing up, increasing the risk of falls. Some studies have even linked long-term antidepressant use to a slightly higher risk of heart disease and stroke, especially in people with pre-existing heart conditions. That doesn't mean you should stop taking them. Mental health is just as important as heart health, and for many, the benefits outweigh the risks. However, if you have a history of heart disease, high blood pressure, or palpitations, talk to your doctor about a safer alternative. 4. Diabetes medications. Diabetes medications help control blood sugar levels, but some can cause dangerous drops in blood glucose, hypoglycemia, leading to dizziness, weakness, and loss of balance. This is especially true for insulin and sulfonylureas like glipizide, glyburide, and glympyride, which stimulate the pancreas to release more insulin. Studies show that up to 25% of emergency room visits for hypoglycemia involve people taking diabetes medications. When blood sugar drops too low, the brain struggles to function properly, causing blurred vision, confusion, shakiness, and even fainting, all of which significantly increase the risk of falls. Additionally, some newer diabetes drugs, such as SGLT2 inhibitors, like Jardiance and Invokana, can lead to dehydration and low blood pressure, making it harder to stay steady when standing up quickly. If you take diabetes medication, it's crucial to monitor your blood sugar regularly and recognize early symptoms of hypoglycemia. 5. Heart medications. Heart medications are essential for managing conditions like high blood pressure, heart disease, and irregular heartbeats, but some can disrupt balance and increase fall risk. Beta blockers, such as metoprolol and propranolol, and calcium channel blockers, like amlodipine and diltiazem, lower blood pressure and slow heart rate, sometimes causing dizziness, fatigue, and lightheadedness, especially when standing up too quickly. A study published in the Journal of the American Geriatric Society found that older adults taking blood pressure medications had up to a 30% higher risk of serious falls. The risk increases if medications cause orthostatic hypotension, a sudden drop in blood pressure when changing positions, leading to dizziness and instability. Additionally, diuretics, often called water pills, such as furosemide and hydrochlorothiazide, flush out excess fluids but can also deplete essential electrolytes, like potassium and sodium. An imbalance in these minerals can cause muscle weakness, leg cramps, and coordination problems, making falls more likely. To reduce risk, patients should stand up slowly, stay hydrated, and monitor blood pressure regularly. If dizziness or balance issues persist, a doctor may adjust the dosage or explore alternative treatments. 6. Anti-anxiety medications. Anti-anxiety medications, particularly benzodiazepines like Xanax, Valium, and Ativan, are widely prescribed to help manage anxiety and panic disorders. However, these drugs slow down brain activity by enhancing the effects of GABA, a neurotransmitter that induces calmness. While this can be helpful for anxiety, it also comes with a downside: drowsiness, dizziness, muscle relaxation, and impaired coordination, all of which increase the risk of falls. Research shows that older adults taking benzodiazepines are at least 50% more likely to experience falls and fractures compared to those who don't take them. But age isn't the only factor. Anyone using these medications, especially at higher doses or for prolonged periods, may experience delayed reaction times and difficulty maintaining balance. Beyond benzodiazepines, other anti-anxiety medications, such as buspirone, can also cause lightheadedness and dizziness, particularly when standing up quickly. Mixing these drugs with alcohol, painkillers, or sleep aids can further amplify the effects, making balance issues even worse. If you rely on anti-anxiety medication, talk to your doctor about the lowest effective dose or alternative treatments to minimize your risk while still managing your anxiety safely. 7. Antihistamines. Antihistamines are commonly used to treat allergies, colds, and even nausea, but they can also impair balance and coordination. First-generation antihistamines like diphenhydramine, Benadryl, and chlorpheniramine work by blocking histamine, but they also affect the central nervous system, leading to drowsiness, dizziness, and slower reaction times. A study published in the Journal of the American Medical Association found that older adults taking first-generation antihistamines had a 20 to 30% increased risk of falls due to their sedative effects. These medications can also cause blurred vision and reduced spatial awareness, making it easier to misjudge steps or obstacles. Second-generation antihistamines, such as loratadine, Claritin, and cetirizine, Zyrtec, are less sedating but can still contribute to dizziness in some individuals. The risk increases when antihistamines are combined with other medications that cause drowsiness, like sleep aids or anti-anxiety drugs. To minimize fall risk, it's best to avoid first-generation antihistamines whenever possible, opt for non-drowsy alternatives, and take these medications at night if needed. If balance issues persist, consulting a doctor about alternative treatments may help prevent dangerous falls. 8. Pain medications. Pain medications, including opioids and certain over-the-counter drugs, can significantly affect balance and coordination. Opioids like hydrocodone, oxycodone, and morphine work by altering pain perception in the brain, but they also depress the central nervous system, CNS, leading to dizziness, drowsiness, and impaired motor control. A study in the Journal of the American Geriatric Society found that opioid use in older adults is linked to a 68% increased risk of falls and fractures. These drugs can also cause low blood pressure, further increasing the risk of losing balance when standing up quickly. Even non-opioid pain relievers, such as NSAIDs like ibuprofen, Advil, and naproxen, Aleve, can contribute to dizziness, particularly in people with sensitive stomachs or low blood pressure. In high doses, they may also affect kidney function, leading to fluid imbalances that contribute to lightheadedness. To reduce fall risk, it's important to use the lowest effective dose of pain medication, stay hydrated, and avoid combining opioids with alcohol or other sedatives. 9. Antibiotics. Antibiotics are essential for fighting bacterial infections, but some can interfere with your balance and coordination. Certain antibiotics, especially aminoglycosides like gentamicin, tobramycin, and streptomycin, are known to be ototoxic, meaning they can damage the inner ear, which plays a crucial role in balance. Studies suggest that up to 20% of patients treated with aminoglycosides experience vestibular toxicity, leading to dizziness, unsteadiness, and even permanent balance problems. These antibiotics can harm the vestibular nerve, which sends signals from the inner ear to the brain, causing a condition called vestibulopathy, a persistent sense of imbalance. Fluoroquinolone antibiotics, such as ciprofloxacin, Cipro, and levofloxacin, Levaquin, have also been linked to dizziness and neurological side effects. In some cases, these drugs can lower blood pressure or cause nerve damage, making sudden movements feel disorienting. If you experience dizziness or balance issues while taking antibiotics, inform your doctor immediately. They may adjust the dosage or switch you to a safer alternative. 10. Parkinson's medications. Medications used to treat Parkinson's disease can significantly impact balance and increase the risk of falls. Parkinson's itself affects movement and coordination, but certain drugs prescribed for the condition can make these issues even worse. Levodopa, Sinemet, the most common Parkinson's medication, helps replenish dopamine in the brain to improve movement. However, it can cause sudden drops in blood pressure, orthostatic hypotension, leading to dizziness and a higher risk of falls when standing up too quickly. Studies suggest that up to 50% of people with Parkinson's experience this side effect. Dopamine agonists like pramipexole, Mirapex, and ropinirole, Requip, can also affect balance by causing drowsiness, dizziness, and even sudden sleep episodes, making everyday activities like walking or driving hazardous. Additionally, anticholinergic drugs used to control tremors, such as benztropine, Cogentin, can cause confusion, blurred vision, and unsteadiness, further impairing balance. If you or a loved one with Parkinson's is experiencing frequent dizziness or falls, talk to your doctor about adjusting the medication. If you're taking medications that affect balance, there are several proactive steps you can take to reduce your risk of falls and dizziness. First, talk to your doctor or pharmacist about your medications. Ask if any of them could be causing balance issues and whether adjustments, like a lower dose or switching to a different medication, might help. Stay hydrated since dehydration can worsen dizziness, especially with diuretics and blood pressure medications. Stand up slowly after sitting or lying down to prevent sudden drops in blood pressure that could make you feel lightheaded. If possible, use handrails when going up or down stairs and ensure your home is free of tripping hazards like loose rugs or clutter. Regular balance and strength exercises, such as Tai Chi or gentle yoga, can help improve stability. Wearing supportive shoes and using assistive devices like a cane or walker, if needed, can also provide extra security. Finally, review your medications regularly with your healthcare provider. If you notice new symptoms like dizziness, weakness, or unsteadiness, report them immediately. Small adjustments can make a big difference in keeping you safe and steady on your feet. If you found this video helpful, don't forget to like, subscribe, and share with someone who might need this information. Stay safe and stay balanced. See you in the next video.